Hi friends, welcome. Today we will explain you all about dry FIP, or Feline Infectious Peritonitis, is a viral disease that affects cats. It is caused by a virus called Feline Coronavirus and can result in a systemic, progressive, and fatal disease. There are two forms of FIP: wet, effusive, and dry, non-effusive. The dry form affects the organs and is characterized by granulomatous lesions in various organs, such as the kidneys, liver, lungs, and eyes. Signs and symptoms of dry FIP in cats can include weight loss, fever, lethargy, difficulty breathing, jaundice, neurological signs such as seizures or balance issues, and eye problems such as uveitis or blindness. Diagnosing dry FIP can be challenging as there is no definitive test for the disease. Only sign and symptoms can clearly tell about story. A combination of clinical signs, blood tests, and imaging studies may be used to make a presumptive diagnosis. However, the only certain way to diagnose FIP is through a biopsy or postmortem examination of affected tissues. Diagnosing dry FIP can be challenging as its symptoms are nonspecific and can mimic those of other diseases. To diagnose dry FIP, a veterinarian may use a combination of clinical signs, laboratory tests, and imaging studies. These may include 1. Physical examination. The veterinarian will examine the cat for signs such as enlarged abdomen, jaundice, respiratory distress, and neurological symptoms. 2. Blood tests, blood work, including a complete blood count, CBC, and blood chemistry, can show abnormalities such as changes in white blood cell count, anemia, and organ dysfunction. 3. Fluid analysis. If there is fluid accumulation in the abdomen or chest, a sample of this fluid may be obtained and analyzed for specific characteristics indicative of FIP, such as high protein levels. 4. Imaging studies. X-rays or ultrasound may be used to look for abnormalities such as fluid accumulation in body cavities or organ changes consistent with FIP. 5. Immunological tests, enzyme-linked immunosorbent assay, ELISA, and immunofluorescence antibody. IFA tests can measure the presence of antibodies specific to the feline coronavirus, which can help confirm a diagnosis of FIP. It's essential to note that diagnosing dry FIP can be complex, and false positives or negatives can occur. In some cases, a biopsy or postmortem examination may be necessary for a definitive diagnosis, as these methods can reveal the characteristic changes in affected tissues. Consulting with a veterinarian experienced in diagnosing FIP is crucial for an accurate diagnosis. Signs and symptoms of dry FIP can vary, but may include 1. Gradual weight loss. 2. Persistent fever that does not respond to antibiotics. 3. Loss of appetite. 4. Difficulty breathing. 5. Jaundice, yellowing of the eyes and mucous membranes. 6. Neurological signs, such as seizures, balance issues, or behavioral changes. 7. Eye problems, especially uveitis, inflammation of the uveal tract in the eye. 8. Lethargy, or lack of energy. Enlarged abdomen due to fluid accumulation, less common in dry FIP. It's important to note that these symptoms can be indicative of other illnesses, so a proper diagnosis from a veterinarian is crucial. Additionally, because the symptoms of dry FIP are nonspecific and can mimic other diseases, it can be challenging to diagnose accurately. If you suspect your cat may have FIP, it's important to seek veterinary care for a comprehensive evaluation and diagnosis. Kidney diseases. One main reason is dry FIP, so please always consider FIP treatment if your cat has kidney disease. Treatment of FIP options. 1. Remdesivir and GS441524 have shown promise in treating FIP in domestic cats. FIP is a fatal disease caused by a mutated strain of feline coronavirus if left untreated. Treatments for FIP often required high doses to be effective, making them potentially cost-prohibitive and burdened with side effects. 4. The use of GS441524 has been described as a miracle for FIP treatment, with reports of thousands of cats being successfully treated and cured with this drug. 5. The successful use of remdesivir and GS4 41524 in treating FIP provides hope for the development of effective treatments for other coronavirus-related diseases in animals and potentially in humans. 6. Further research and clinical trials are needed to fully understand the potential benefits and risks of using these drugs to treat FIP, as well as their long-term effectiveness and impact on the overall health of affected animals. 7. Access to these drugs and proper FIP Warrior 5. Zero Group's guidance is crucial for the safe and effective treatment of FIP in domestic cats. For more informative videos, please watch our videos and subscribe our channel.